with a person that when I do my CrossFit coaching in some of my off time from clinic, and I just want to have this quick discussion about what kinds of things to do and how to kind of navigate that situation. So it was a guy 2 maybe 3 weeks ago at this point. We were doing a workout. I can't remember exactly what the session entailed, but there was some toes to bar and some deadlifts and maybe something else. And somewhere during the workout, he developed a pretty sharp pain, kind of in that lower mid back region, and it kind of stopped him. And we just called the training day at that point, and the pain got pretty intense on him, which is going to happen when people have kind of like an acute strain of an area. And on his own, he ended up having some X-rays done, which is fine, valid. He was concerned enough on his own to go and have it looked at. And my first thing is kudos to whoever did the imaging with him and discussed it with him, because they didn't end up leaving him feeling terrified of something going on with his back, or try to convince him that he needed a whole bunch of visits with a physical therapist or chiropractor or something like that to to correct the issue or whatever it might be. So when he came back, he took about a week off, which is fine. He just didn't feel like he could come in and do anything. And then when I saw him again, he said, it's been feeling better, but it still bothers in this situation, that situation. So all we do is, some of the big things are off the table already. Like he's not falling into a spiral of catastrophe. He's not thinking that he has like some degenerative change that's going to make him, that's going to make him, have back pain for the rest of his life or anything like that. He just, they were very straightforward with him about what was going on. And I just told him, hey, you got the X-ray done, that's fine. You found out that there wasn't anything serious going on, so that means the way out of this is, is back into training and tolerable ranges, tolerable movements, getting the body to reduce the sensitivity of whatever happened in that area. And most of those kinds of things, if people don't catastrophize, if people, most gym-related issues like that, train-related issues like that, where people kind of have a sudden sharp pain somewhere in the spine, most of that stuff will resolve, without a whole lot of intervention within a few weeks anyway. And so I just encouraged him, reiterated to him that, remember, it's not severe. Remember, it's been improving with some rest. So we're just going to take this chance to modify some of the work we're doing, change the loading vectors, change some of the movements, reduce the intensity, reduce the volume on some of the activities, and we'll just keep moving forward, and you'll feel pretty good pretty soon. And lo and behold, 2.5 weeks, 3 weeks go by. He's down to minimal discomfort, a little bit of pain in the area with some, when he's got a hang, that traction still creates a little bit of sensitivity, but that's also improving. So, the point of it is, this was all handled very well, right? The guy had an incident. I had him sit out the rest of the training for that day, do some breathing, some light movement, things like that. He took a little bit of time off. I didn't, even though I'm in the healthcare field, I didn't encourage him to get an image or anything like that, because I know that more often than not, these things aren't serious, and they typically find something on an X-ray to hold on to make you scared and to make you do something with them, and which thankfully didn't happen in this case. But the big, the overlying story is when you have something like that happen, is to be able to handle a situation with the athlete, client, whoever it is, without creating a sense of urgency, without creating a sense of fear with them, and getting them and try to keep them within the community and getting them back into their training as quick as you can within tolerable limits and loads and frequencies. And you may have to modify some of the exercises for a while, but for the most part, returning to as much normal stuff with some loading, with some variations on some of the things that may have been bothering them will help to reduce that sensitivity of the body, help get the nervous system to calm down about the threat levels associated with what happened. And as the body goes through tolerable movements, tolerable levels of loading, tolerable, it's a lot of tolerables in a row, tolerable frequencies and volumes, you're going to retrain everything to handle that again as it heals. And by now we're about a month away from it. He's going to be back to pretty much train as normal. Some of that conditioning is going to have to get kicked back in as there's that reduction in workload, but business as usual. Just helping him and helping people understand. There's no reason to freak out when something like this happens. There's no reason to get involved in some long treatment plan with somebody. If you can find tolerable ways to keep active, it's going to be the less you do to the area, the less you have done to the area, the better as the body kind of goes through that process. Yeah, of course, if he had that X-ray done and it showed some sort of fracture or something like that, well, then it's a different case. But since all that stuff is immediately ruled out, well, we just know that it's going to take some time, but you'll be fine if we just create small modifications and do business as usual. So hopefully this helps some people think about these things, think about it when they're working with their own athletes, think about it when they're training themselves, and check my channel for more video, and see you next time.